Hi, I'm Dr. Rasya Dixit. I'm a dermatologist in private practice in Bangalore from the last 15 years. Today, we are going to talk about how to treat pus-filled pimples. So, when we talk about pimples, there are very different types of pimples, right from blackheads and whiteheads, which are just not very inflammatory conditions. Then you have the papules, which are red color pimples, which do not have any pus. Then you have pustules, which have a lot of pus and it is indicative of lot of inflammation. Then you have the nodules and the cysts, which are like much bigger lesions and they are more deep-seated than the pustules. When we talk about pustules, the first thing we dermatologists like to know is that it's an inflammatory type of acne. That means there is a lot of infection and inflammation happening in the pimples. Pustules tend to heal with red marks as well as scars, so they need to be treated well. So if you have an acne which has a lot of pustules, I think it is a good idea to seek the help of a dermatologist. And while you are doing it, make sure that you start a salicylic acid based face wash, and you can use a topical antibiotic like clindamycin to apply only on the pimples. Remember, using a retinol on top of a pustule may actually increase the inflammation of the acne. So don't use these treatments without any suggestion by a dermatologist. Doctors or dermatologists usually prescribe oral antibiotic agents as well to treat pustular acne. This is not to treat any particular bacteria as such, but it is to reduce the inflammatory process which gives rise to the scarring and the redness which is often associated with pustular acne. But let us come to the piece of cake where you have a big event coming up and you have a large pustular acne or a cyst on your face. There is something which can be done as a quick fix. Usually we inject something called an intralesional steroid and a combination with hyaluronidase into the pimple. Within 12 to 24 hours the pimple disappears. So if you have a pustule, don't pick it, don't put ice on it, don't put garlic on it. They can all cause inflammation and scarring. Instead, speak to your dermatologist who can give you long-term solution in safe solutions in acne care.